Well, hello and good morning. This is Dr. Yonnette with another episode of Baby Talk. How are you? How was your weekend? I'm sure you're ready and excited to start the new week, ready to go. And so as we prepare for the new week, taking care of baby, taking care of you, I wanted to continue our discussion from last week on alcohol. And this time I'm talking about alcohol and breastfeeding. Alcohol and breastfeeding. We talked before about what happens when you drink during pregnancy. And so let's consider a little bit about what happens after you have delivered your baby and you have started to breastfeed. What do you need to know in regards to drinking and breastfeeding? So I'm sharing information from the CDC, and I'm going to start off with the statement: not drinking alcohol. The CDC says not drinking alcohol is the safest option for breastfeeding mothers. Let that sink in. It's the safest option for breastfeeding mothers. Now, let's go through the discussion and find out where you are and what you can expect if you drink alcohol and breastfeed. So the question here is it safe for mothers to breastfeed their infants if they have consumed alcohol? Remember that first statement. The safest option is to not drink. But the CDC is saying generally moderate alcohol consumption, which moderate means up to 1 standard drink a day, is not known to be harmful to the infant, especially if the mother, you drink and you wait for about 2 hours, 2 hours after you take that one drink before you breastfeed. And they're saying, the CDC is saying, it's not known. But, you know, information is becoming more and more available as we continue to research. But at this point, drinking 1 standard drink of alcohol per day does not seem to have an effect on the milk that you give to your child if you wait 2 hours after drinking. But exposing your child to moderate levels, exposure to alcohol above moderate levels could be damaging to your child's growth and development and sleeping patterns. Alcohol consumption above moderate levels can also impair your judgment, mom, and your ability to care safely for your child. Remember, take care of you so you can take care of baby. So, drinking alcoholic beverages is not an indication to stop breastfeeding, because we've been saying this over and over and over again. Breastfeeding is so important to your child's development, developing those protective responses in terms of immunity, and giving your child the best option to fight diseases. So you can keep breastfeeding 6 months, a year, 2 years. Breastfeed as long as 3 years. You know, give your child those options, those opportunities to be able to develop well. So can alcohol be found in breast milk? If you are drinking, is there a possibility that alcohol can be found in breast milk? And here the answer comes back loud and clear. Yes. Alcohol levels are usually highest in breast milk 30 to 60 minutes after you have consumed the alcohol. It's detected in breast milk about 2 to 3 hours per drink after it is consumed. 2 to 3 hours per drink after it is consumed. The length of time, though, that alcohol can be detected in breast milk will increase the more alcohol you consume. You hear that, Mom? The more you consume, the longer the amount, the increase, there is going to be an increase in the amount of alcohol in your breast milk. For example, alcohol from one drink can be detected in breast milk for about 2 to 3 hours. Alcohol from 2 drinks will be about 4 to 5 hours. And alcohol from 3 drinks can be detected for about 6 to 8 hours. However, blood alcohol levels and the length of time alcohol can be detected in breast milk after drinking will depend on a number of factors, including the amount, how fast you consumed the alcohol, and whether it was consumed with food, how much you weigh as a mom, and how fast the alcohol is broken down in your body. Oh my goodness, there's so much to consider. So much to consider. So what effects does alcohol have on the infant? So moderate alcohol consumption by breastfeeding mothers, and moderate, we said before, was up to 1 standard drink per day, is known to be harmful to an infant, especially if the mother waits. I said, it's not known to be harmful, especially if the mother waits for about 2 hours before nursing. However, the higher level of alcohol consumption can interfere with milk ejection, while maternal alcohol levels are high. Okay, so you may have lower milk ejection. And then over time of consuming alcohol, this can lead to shortened breastfeeding duration due to decreased milk production. And then excessive alcohol consumption while breastfeeding could also affect infants' sleep patterns and early development. Let's look at a pump. Let's see if we were pumping breast milk after consuming alcohol. Does that help with reducing the amount of alcohol in mom's milk? And the answer to that is no. The alcohol level in breast milk is especially the same as the alcohol level in the mother's bloodstream. So expressing or pumping the milk after drinking and then discarding it does not reduce the amount of alcohol present in a mother's milk more quickly. So, some mothers got smart, they drink and then they want to pump off that first set of breast milk, throw it away, and then breastfeed the child. That doesn't help. It doesn't work. So, your best option for taking care of baby is to decrease or, just not drink. You're breastfeeding, stay away from alcohol so that your child can get the best milk possible, and then the best option for growth and development, because like we said earlier, alcohol consumption can affect sleep patterns and your child's development. I know, Mom, you want to give your child the best option for life and development, and if you are struggling with alcohol consumption, get help. Get help for yourself so that you can provide what your child needs. And remember, taking care of you is the first step in making sure that your child grows and develops well. This is Dr. Yonnette, thanking you for joining me today and looking forward to seeing you again as we discuss baby talk.